Every single day, nearly 100 men lose their lives to a disease that could have been caught early and often beaten. Prostate cancer isn't an automatic death sentence, but ignoring its early warning signs is what turns it deadly. Just imagine this. You're a healthy, active man. You go to work, exercise, enjoy life. You feel fine. Then slowly, small things begin to change. You start waking up more often at night to urinate. You feel a slight pain when sitting down. Sex feels different. There's some discomfort, maybe even pain. But you tell yourself, it's just age, nothing serious. A few months later, you're sitting in a doctor's office hearing the words. You have stage 3 prostate cancer. It's already spread to your bones. This isn't some rare, tragic tale. This is the reality happening to men every single day. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Over 288,000 new cases are expected this year in the U.S. alone. Nearly 34,700 men will die, not because they couldn't be helped, but because the warning signs were missed. So what's the real problem? Men often stay silent when something feels off. They're reluctant to talk about their symptoms, delay checkups, or simply don't realize that what they're feeling could be serious. And yet, when prostate cancer is detected early, the survival rate is as high as 98%. That's why today's message is urgent and possibly life-saving. We're going to break down the 8 earliest and most dangerous signs of prostate cancer. Not just for older men, not something that's normal with age. These are signals from your body that can determine whether you live or die. In this video, you'll learn the subtle symptoms most men overlook, why your body sends these specific warning signals, and when it's time to stop waiting and take action. If you're a man or love a man, you need to hear this. We often think of cancer as something that arrives with drama, sharp pain, visible tumors, or drastic fatigue. But prostate cancer doesn't work like that. It whispers. And if you don't listen carefully, it will become louder when it's already too late. Here are 8 early warning signs that your body might be waving like red flags. If you or someone you love is experiencing any of these, don't delay. These are not just normal aging. Frequent urination, especially at night. Do you find yourself waking up 2, 3, even 4 times a night to use the bathroom? That may not be just a full bladder. It could be an enlarged prostate pressing against your urethra. This is often one of the first signs that something's not right. Why it matters. As the prostate grows abnormally, often due to inflammation or cancer, it disrupts urine flow, leading to urgency and frequency, especially at night, called nocturia. Pain or discomfort during ejaculation. Most men ignore this or feel too embarrassed to mention it. But if you feel a sharp pain or burning sensation during ejaculation, that could indicate inflammation or tumor pressure inside the prostate. Why it matters. Tumors in or around the prostate can irritate sensitive nerves and tissues that play a key role in sexual function. Blood in urine or semen. Any trace of blood, no matter how small, is a medical red flag. This can be a sign of prostate cancer, infection, or trauma, and should never be ignored. Why it matters. Tumors can disrupt or rupture nearby blood vessels, causing bleeding into the urinary or reproductive system. Pain while sitting. If sitting for extended periods causes pain in your lower pelvis or tailbone, it might be more than just a back issue. It could mean your prostate is inflamed or enlarged, pressing on nerves and tissues. Why it matters. An enlarging tumor or inflammation can affect the space around the prostate, especially near the rectum and pelvic floor. Lower back, hip, or chest pain. Cancer that has spread, metastasized, often targets the bones, especially in the spine, hips, and ribs. If you're experiencing deep, unexplainable pain in these areas, get checked. Why it matters. Prostate cancer has a strong tendency to metastasize to bones, making pain in these regions a serious red flag. Swelling in the legs or feet. This may seem unrelated, but swelling in the lower body can signal that lymph nodes are blocked, or that the cancer is pressing on nearby blood or lymphatic vessels. Why it matters. Prostate cancer can cause lymphatic obstruction, leading to fluid buildup in the legs, a condition known as lymphedema. Unexplained weight loss. Losing weight without changing your diet or exercise routine is a major sign that your body is fighting something serious, possibly cancer. Cancer cells demand energy and can speed up metabolism abnormally. Why it matters. Sudden weight loss is often a sign of systemic illness, including cancers that are becoming more aggressive. Numbness or weakness in the limbs. If prostate cancer reaches the spinal cord, it can interfere with nerve function, leading to tingling, weakness, or numbness in the legs and feet. Why it matters. This may indicate spinal compression, a medical emergency where cancer affects the nerves controlling the lower body. Real story. If I had known sooner. Carlos, 61, thought he was just getting older. Frequent urination, some minor back pain, and occasional discomfort during sex. It didn't seem urgent. He was still jogging on weekends and working full-time. But when he began feeling numbness in his legs, his wife insisted on a checkup. The result? Stage 2 prostate cancer. Fortunately, it hadn't yet spread. After treatment, diet changes, and regular checkups, Carlos is now cancer-free and speaking out to help others catch it sooner than he did. So what can you do? Here's how to stay ahead of prostate cancer. Listen to your body. Don't dismiss changes as normal aging. Talk openly about symptoms, even the awkward ones. Get screened regularly. PSA blood tests and digital rectal exams are simple but life-saving. Know your risk. Men over 50, African American men, and those with a family history need extra vigilance. Support your body. A healthy diet, more on that in Part 3. Regular exercise and stress reduction all contribute to long-term prostate health. These 8 symptoms are not random. They are coded warnings from your body, giving you a chance to act before it's too late. And sometimes, that awareness, just knowing what to look for, is enough to save your life. Now you know the truth. Prostate cancer doesn't come crashing in. It creeps in slowly, quietly. It hides behind symptoms we've been taught to ignore. But you are no longer in the dark. You now know the 8 signs that can make the difference between early, treatable detection and late-stage regret. And if you take action early, here's the good news. You can live, you can thrive, you can beat it. Catch it early, and the survival rate is over 98%. Get checked regularly, and you give yourself control. Talk about it, and you might save not just your life, but your brothers, your fathers, your best friends. This isn't just about fear, it's about empowerment. It's about knowing what to look for. It's about refusing to be one of the thousands of men who say, "If only I had known." So here's what I want you to do. Your next step, be part of the change. Drop a comment below. Have you or someone you know experienced any of these symptoms? Are you planning to get screened? Let's talk openly. Let's break the silence together. Hit like if this video gave you clarity or motivation. Subscribe to stay informed. We're covering more topics that could save your life. Share this video with a friend, brother, dad, or partner. You never know who needs it most.